People with rare diseases face two clear needs to improve their quality of care. One is rapid and efficient diagnosis, and the other is a range of treatments that are effective in treating the complications from their rare disease. To meet these challenges, we require more evidence, more data. For example, we need to know how patients are currently diagnosed to see if there are ways we can improve the efficiency of diagnosis, and also understand how new techniques such as genomics and new blood tests or imaging techniques can be used to speed the time to diagnosis. For treatments, this is a big challenge for us. Around 95% of rare diseases do not have a specific treatment, and sometimes we use treatments used for common diseases to treat these rare diseases with very variable results. By engaging with research into rare diseases, we can identify a number of key issues. First of all, how many people have the rare disease? What happens to people with a rare disease during childhood, during adulthood, or even later in life? And then what happens in terms of complications? Do all patients or all people with a rare disease have the same complications? Or are there groups of people with a rare disease who develop specific complications at different times of their life? I think there are many reasons why people find research difficult or maybe not prioritize it as much as they would do. The first one is the lack of information that's accessible for them. Everyone has a busy life. Often if one has a rare disease, there's maybe lots of hospital appointments. The rare disease itself may make normal things that we do, such as walking or self-care, difficult and challenging. And there's often a perception that taking part in research is really an extra burden that they can't face at the moment. Another issue is around data and control of their information, who can see their information. We live in a very open world where lots of information is shared, and there's great sensitivity, which is appropriate to make sure only those authorized to look at data that people have put in, that's often very personal, is looked at in an appropriate and safe way. And finally, it's what's the impact of the research? How will people know investing their time, their often some discomfort if they're having blood tests or other scans, actually lead to a change in research? All of these issues have been addressed by the Rudy Study in some way or another. First of all, we have lots of information about what the Rudy Study can involve, and we make this freely available on the Rudy Study website, www.rudystudy.org. On the website, there is a library where people can really understand what they're letting themselves in for if they take part in research. An important component of the Rudy Study is a concept known as dynamic consent, which is really highlighted by a professor we have in Oxford called Jane Kay. And this is a process by which there's a two-way engagement between the researchers and the people taking part in research. And it's a meaningful engagement. On the first hand, people can vary how much they take part in research throughout the study life cycle. So for example, if their life becomes busy for some reason, they can select to actually take less active role in research, but still stay within the research study. So if in later time they have more time, they can invest more time completing questionnaires or study visits. This is really important because it gives the people taking part in the research control over how much they're actually contributing to the research, rather than feeling they're signing a contract which they're obliged to follow. Equally as important is engagement between people and researchers, and it's meaningful. So for example, in the Rudy Study, we have a patient forum that meets by Skype every 6 weeks, where we openly discuss where the research study is going, what results we found, and importantly, how we can improve the research so it has a better fit with what patients want. We've also engaged with the James Lind Alliance to actually ask people with rare diseases, their carers, their family, and also their doctors, what they think should be the research priorities for the future. And it's this engagement very close between people taking part in research and the people with a rare disease, make sure that what we look for in our research agenda actually maps to what will matter to people with rare diseases. So as part of the Rudy Study, if any paper is published using Rudy data, then a summary using plain English is put on the person's website So on the person's personal profile webpage, they can directly see the benefits they've realized by taking part in the Rudy study. I think if you're thinking about taking part in research, be informed. Read about the research, talk to people who may be involved in the research already, and really ask questions. And ask questions that are meaningful for you. What will it involve? Why have you asked me? What happens if I stop taking part? And what will be the benefits of taking part as well as the risks? The benefit of taking part in the Rudy studies, you can actually tailor or change how much you take part in this research according to your personal needs. People within Rudy are in the same study but are all doing slightly different things depending on their consent options or dynamic consent options. I think it's important for people to understand what's the value of research. We've identified through our reading and our evidence that actually there's a huge care gap for people with rare diseases, both in the diagnosis and treatment. And the only way we're going to close this care gap to make sure in every healthcare system there are readily available treatments and tests for people with rare diseases is to provide governments, healthcare providers and decision makers with the evidence they need to prioritize rare disease treatments and tests above others.